Hello. Today I'm going to talk on early signs of autism spectrum disorder. Parents and primary caregiver usually have a close view on the abilities and the skills that child acquire on day-to-day basis. They usually have keen observations and they can keep a note of a developmental milestones of a child. Identifying the early signs of autism spectrum disorder is not the presence of an abnormal or unexpected behavior, rather, an absence of a normal developmental milestone. According to the Center of Disease Control and Prevention, most of the parents of the autism spectrum disorder are able to identify some developmental delays in first year of the age of the child itself. Number one is eye contact. Usually, a child develops eye contact around 2 to 3 months. But the child who is having a potential to develop ASD is found to be less or making a very limited eye contact. This could be one of the indication. Number two is pointing and gesturing. Usually, the child having ASD or going to develop ASD makes very less gestures and they do not follow your pointing. So, this is one of the indication of the potentiality to develop ASD. And as soon as you point, the gaze of the child follows your pointing, and this is known as joint attention. Now this is something which is very less developed or again limitedly developed in a child having ASD. Number three is identifying the name or recognizing the name. A child around 9 months of age is able to take a cognizance of their name. So when you call, they at least look at you or they try to identify that from where someone is calling. So this a child attains around the 9 months of age. So this identification is, according to research, also found less in the kids who are having a potential to develop ASD. Number four is reduced emotion in facial expression. It's not that the autistic kids do not have an emotion, but an ability to express emotion through facial expressions is very limited in kids with ASD. So this is another sign. Most of the children express or communicate. The way of social communication in the kids is through their gestures. They rather smile, they cry, they make faces, and they make gestures. This is the way they communicate. So the children having ASD has very limited capability to express their emotions through their gestures. Number five is delayed speech and language. So a child should be able to speak few words or few sentences or the phrases with 2 to 3 words around possibly 1 year, or maybe around 2 years of the age they should be able to speak a short phrases. If this is something that a child has not attended, then it is important to take the note of it and to visit a pediatrician. And number six, which is very important, is regression. Now, if a toddler has learned, has acquired the language ability, and if he is babbling, if he is making a gestures, if a child has started showing the social skills and showing the gestures, but if this is something that suddenly regresses or he stops making an eye contact, he stops making the use of the language, and this is something which is occurring after some acute disease or some acute illness, or even if it has occurred even without any cause, this is something which is known as regression. Regression means the skills or the ability that is acquired, but suddenly it is regressed and now the child is not expressing it. So this is one of the very important sign that is also indicating towards autism spectrum disorder. So these are very early signs, and this could be understood only by the one who are very close to the child or who closely observe a child. And this could be indicative of autism spectrum disorder. Once a child attains certain age, it could be diagnosed. Till then, there it is just a potentiality of the case to be having ASD. And once it is diagnosed, homeopathy has a wonderful treatment in that. And knowing the child through his behaviors, how he performs at the home, how he is with the strangers, how he is behaving, how is his nature, what are his likes and dislikes, how is his reaction to the known objects and unknown objects, and what is it that is delayed in a child? Is it a language? Is it a walking? Is it making gestures? Is it a smile? Each and every child has a different developmental delay, which is very peculiarity of each and every child. So the peculiarity of the child is understood in homeopathy, and based on that the holistic case taking is done, and through that exact simulacrum for the child has been selected, which helps a child to maintain the balance. And an attempt is made that with this limited uh, or delayed milestone development, the child is still able to function and is able to undergo the life where he can live independently, and attempt is being made. So this is how the homeopathy works in autism spectrum disorder. I hope this video on early signs of autism spectrum disorder and the role of homeopathy in it would be helpful to you. Thank you so much.